The Australian Defence Force has sent a second team of doctors and nurses to the earthquake zone in Indonesia. An engineer and health team assessed facilities at the provincial hospital in Padang, where most of the post-disaster recovery operations will be centralised. Damage to infrastructure in Padang City is extensive, and hospital staff have been forced to treat the injured in makeshift tents outside. Well, joining us now on the line is Associate Professor Harry Minas from the University of Melbourne. He's Director of the University's Centre for International Mental Health. Professor Minas, thanks so much for talking to us this afternoon. Now, you were part of an assessment of the psychological needs of traumatised victims after the Boxing Day tsunami of 2004. What similarities do you think that these people in Padang will be facing?
I think there are a lot of similarities and there are some differences. The disaster in Aceh happened in a different context where there was a long-running conflict, a lot of concerns about security, and most of the people died as a result of the tsunami. Here, there's a devastating earthquake in a very different situation, but the loss of life seems to be very substantial here as well.
All the focus, of course, goes on to food and water and all of those essentials, but not much attention is paid to the mental health of survivors, is it?
Well, I think it's perfectly appropriate that the focus should start on those absolutely essential things: clean water, food, shelter, safety of people, the survivors of the earthquake. The thinking about mental health, though, has to come in pretty quickly on the heels of that emergency response. The long-term consequences are largely mental health consequences.
So what sort of symptoms do we see then in people who are left behind?
They're the common symptoms, common mental health problems. A lot of families will be bereaved. A lot of families will be dealing with the fact that they've lost not only their house where they live, but also their livelihood. The economics of the city are disrupted. So there'll be a lot of traumatic responses, but there will be a lot of depression, anxiety, common mental health problems.
I guess events like this too would perhaps bring up some pre-existing problems that were just below the surface.
Well, I think what a disaster like this shows is the weaknesses in the system that existed prior to the disaster. So, for example, where there's not a very effective mental health system, that becomes very much clearer after a disaster like this. And the disaster is often an opportunity to rethink what are the problems in the system and to think mid to long term about the opportunities for development, not just reconstruction.
So often disasters like this, which tend to hit poorer areas, they can become a catalyst for improved services?
They can, and they have done in Aceh and also in Sri Lanka. In Aceh, for instance, where there was practically no mental health service at all apart from a mental hospital in the capital, there is now a functioning community mental health service in most of the districts of Aceh, and it was really the disaster that created the opportunity to build a new mental health system for that province.
Do you know of any plans to send mental health professionals over to Padang, to the area that's been affected by this quake?
There are people already there. I've been in contact with the Ministry of Health, with the Directorate of Mental Health. There's a very active program which has already been started. All of the people in Indonesia, in the Directorate of Mental Health, in WHO Indonesia, from the University of Indonesia and other universities are now very experienced at developing a mental health response following a disaster like this.
Well, that's at least some good news to come out of this. We thank you for your time this afternoon, Professor Minas.
You're very welcome. Thank you.
World Vision CEO Tim Costello, who's at the earthquake site in Padang, says rain is not helping the relief effort.
With this rain, some 500,000 people are badly exposed. That's why World Vision has been delivering family kits. Kits with matting and shelter, mosquito nets, cooking, utensils, and setting up child-friendly spaces to protect children in the chaos when orphans have lost their parents and no one's looking out for them.